Doc Hamels, host of Chautauqua Sunrise, and it's my pleasure to host another Chautauqua Strong Moment. We've been doing a series of these to bring information to you during this coronavirus pandemic. And with me today is Dr. Robert Berke, a county physician, who has some very interesting information to talk to you about face masks. Bob?
Thanks, Doc. Since last time we chatted, things have changed.
I know. I even got my own.
I know. I think when we talked last, the number of cases was in the few thousand, something like that. Now we're up to 1.1 million worldwide, almost 70,000 deaths. United States, 250,000 positive tests, and 7,000 deaths. And New York State, of course, and New York City is the epicenter at the moment. We're at war. And that's who we are. And we're at war with a virus that does not discriminate. Race, color, creed, whether you're red, blue,
wealthy,
purple,
poor,
wealthy,
right.
poor, Christian, Muslim, Jew, it doesn't matter. This is a virus that is novel, meaning we have not seen it before. Therefore, humans do not have innate immunity unless they're very fortunate and resist this easily. We are probably seeing in storm parlance, not a 10-year, not a 100-year, but a 500-year storm, even though we had a 100-year event with respect to pandemics, because 101 years ago,
Right.
the Spanish flu, misnomered because it did start in an army barracks in the United States, but it's the Spanish flu, killed 50 million people worldwide. And right now we're scrambling. From a perspective nationally, we have 50 states all trying to manage very short supplies. Communities like ours doing miraculous work, organizing, dealing with very, very limited resources and marshaling those resources to get ready for whatever comes. This county in particular that I work for and work with, the county exec and the team that he put together, they've got religious groups, business groups, obviously the hospitals, doctors. I meet with the doctors group twice a week to discuss issues of what we do in the office practice and best practice, telemedicine, whatever else. And still, we are facing an enemy that knows no boundaries and is spreading, if you look at the maps, in a wave across this country. And one of the discouraging things is each community is going through the same rituals, and there seems to be less than a coordinated effort to deal with this on a large scale. That being said, there are things we have learned from 100 years ago. And last time I was on, we talked about social distancing.
Absolutely.
I think most people now understand or have heard the terminology flattening the curve. The curve is just a statistical description of the incidence of disease in your community. And when it hits, it either hits with a huge wave right off, like we're seeing in the epicenters, New York City, Louisiana, those places, and it's overwhelming their systems because we could not anticipate this number of critically ill people and don't have the resources to handle them. So what the objective is to flatten the curve. Flatten it means squash down that surge and spread it out. We have it in the community. We know it's community spread. So we're not going to prevent all the cases. What we can do is stretch them out if possible.
Slow it down.
And slow it down and maybe have to suffer through it on a longer way, but the curve starts to look like this rather than the big spike, which overwhelms us. So we get back to now mitigation. Well, 100 years ago, that's a long time ago.
Yeah.
My folks were alive then. They lived through this. They were putting bodies out in the streets. That's how many people were dying. And they're now putting bodies out in the streets in Ecuador. You've seen those pictures.
In the boxes,
yes. Yes, in the boxes. And we are talking about refrigerated trucks and hockey rinks, and because there are places where the curve looks like that.
Just overwhelming.
And it's overwhelming really amazing facilities that do heart transplant, lung transplant, everything else, and they're being overwhelmed by a submicroscopic agent that you need to look at with an electron microscope.
So what do we do?
What do? We go back to 100 years ago and look at the data, which is really remarkable. The cities that were very slow to react had a curve that looked like this, mortality-wise.
Okay.
The cities in the United States that reacted very early with social distancing, the kind of things we're talking about, had a curve that looked like this, and their mortality was much lower. Yes, the cases dragged on for a little while, but they had much less mortality. So we know that what we talked about originally 2 weeks ago when I was here, and what has been talked about for a while now, is social distancing. Now, we still have a significant number of states that are not doing this. This is insanity because it's coming there. And if you think that your state boundary is going to protect you, this is crazy. You can mitigate and actually flatten the curve in those places if you do this. What we can do is what we've been doing, social distancing. Really, really important. Very, very simple thing to do, very hard to do from a self-discipline, whatever. You saw the pictures of the kids on beaches and parties. This is insanity because what we now know is that just you and I talking here, if I'm asymptomatic and a spreader, a super spreader, I'm infecting you. So the other mitigation that we can do is the use of masks.
And you brought...
I brought a collection because I want to go through this because, again, there are masks and then there are masks.
Okay.
And the first mask I want to talk about is the N95, which is this one, only for use in healthcare centers, EMTs, firemen, police, no one else. It is an extremely short supply. It will save the lives of those people who are going to save your life. Every time you use this one walking out on the street, walking your dog, you are potentially reducing the supply of these for the people who may be needed to save your life.
So us commoners don't need that.
Totally unnecessary.
Gotcha.
Okay? And if you use it, you're actually doing a disservice to those people who desperately need this and are burning through them, trying to keep people alive.
So if we have supplies someday, we'll let you
Give
know.
them to
But right now,
give them to the fire department, give them to the EMTs, give them to your local hospital.
Okay.
They're desperately needed and in short supply.
all right, so what should we use?
Let me go on.
Okay.
Then there are shields.
Shields.
This is a commonly used shield, which now the price has gone sky high
Imagine
on coming
that.
from China.
Imagine that.
Again, only for use where you're intubating a patient or a patient is critically ill, and it should not be used anywhere else.
Not for us.
Not for us.
All right.
Then we have a locally made one, actually in Brockton. This is made by Jamestown Plastics, and this is a really neat little device. They're going to be mass-produced. They fit like that with a Velcro, and they're marvelous.
Yeah.
And actually, they make the use of an N95 a little less necessary because they're protecting against, but again, only for use.
Not for us, again.
Hospital, first responders, dentists, any healthcare provider. That's it. Nobody else. And if you go out and start using these, again, you may be denying the use to someone who desperately needs it, who actually may try and save your life someday and may not have one of these to work with. So then we get down to a hospital mask. This, all of you who've had surgery or been in a hospital, this again should not be used out in public. This is a very efficient means of protecting hospital staff from dispersal spray from a cough, a sneeze, and also for their work. These are in short supply and should not be used except, there is an exception. If you have MS, if you're on chronic steroid therapy, if you're being treated for underlying cancer with chemotherapy, you would have been given one of these to leukemics, people using immune mediating drugs. You see all these marvelous drugs being still advertised for psoriasis and whatever else at this time when they say at the end, this could harm your immunity. Sure. But those people taking them should be wearing one of these because this will protect you from droplet spray.
So pre-existing condition that
Exactly.
put your life in danger.
Exactly. But again, if you're just using this, walking around, and you have no pre-existing condition, you are possibly denying a healthcare worker of the chance to have one of these and save someone's
All right,
life
so now
and save their own life.
So the first four, not for us. All right.
And then we come to this fellow.
All right.
I got this from my office. One of my staff made it herself. It's just a bandana, basically. And they put little elastics on to go around your ears. Now, in the last couple of days, we've heard a lot of discussion about the use of these. And actually yesterday, nationally, they talked about a voluntary use of these. The CDC is saying people should use these when they go out. The president says it's voluntary. I think people should use these. The reason people should use these is we're a very generous nation. We give billions of dollars away to charities. We look after our fellow citizens. You wear this, you're protecting your fellow citizens from the droplet spray when you cough or sneeze or talk. It does I can't say absolutely nothing for you, but if you think you're protecting yourself with this, you are sorely misinformed. These are not to protect you. This is your contribution. The 30% of you who are silent spreaders out there, super spreaders, who have coronavirus, have not been tested, are feeling well, but you're out there in the community. If you put one of these on, you're protecting the rest of your community. That's the use.
So act as if you have it.
Act as if you have it. Wear this when you're out in the community. I see people wearing this driving in their car. This is craziness. All you need to do is wear this when you're out in the community with other people, and you will be doing a favor to your friends and neighbors and protecting them from potentially infecting them. Okay. There is a study that was done on a choir, 80 people, I think, just singing, social distancing. 60 of them infected, 2 dead.
I saw that.
And just because of the spread. If you've ever seen pictures they've done of people coughing or sneezing and the distance,
the spray. Yeah.
Yes, the droplets go. These will stop the majority of those droplets and will decrease the spread. Okay? I have one more thing to show you.
Okay.
I brought with me these pennies. You see them?
Your 2 cents worth.
No, they're shiny pennies. You see them?
I do.
Well, I just distracted you from the real story.
Oh,
the real story is wear the mask. Don't get distracted by chloroquine, hydroxychloroquine, by azithromycin, by the blood transfusion, the plasma transfusions, by everything else that are talked about in the media and on Facebook and whatever else. They are shiny pennies thrown out there, and they distract us from the reality, which is 100 years ago we learned that you can mitigate this by just social distancing. The second thing we know, that we can help the population protect each other by wearing these. The rest of it will come when it comes, but don't get distracted by little things that are out there that are either meant to distract you or inadvertently distract you by the press or by whatever else. Keep your eye on the ball. This is really dangerous stuff. I have worked in some very, very difficult situations in refugee camps in Thailand during the war in Cambodia. I've slept in mud huts in Africa and seen terrible things. But this is really serious business. And this is not a hoax. This is not a fabricated story. This is serious business. And if you don't take it seriously and you go partying and doing things, you are putting yourself at extreme risk.
Folks, you've been watching a Chautauqua Strong Moment with Dr. Berke, who has just given us unbelievably good advice and suggestions for wearing masks when you're out in public. Thanks for joining us today, Bob. And is there a phone number people can call to have questions?
Well, there is one more thing. In Chautauqua County, there is now, working with the medical community, and I don't have the phone number with me, and I'm sorry, but there is a find a doc process for people who do not have a physician. Either they're undocumented or they have insurance but have never seen a physician or are just unattached, that they will be hooked up. And we have all these physicians willing in this time of crisis to take anybody who comes who needs assistance, which is really quite a nice thing to do. And I don't have the phone number with me, but the Chautauqua Health Network or the county has that number for people.
Okay. Well, thanks for joining us. Folks, let's stay Chautauqua strong. I'm Doc Hamels, and we'll be talking to you again.